Hey Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 100 Practice NCLEX questions. Without the way, let's get started.
A nurse determines that, according to Erickson, establishing relationships based on commitment mainly occurs in which stage of psychosocial development? 1. Middle-age adulthood. 2. Young adulthood. 3. Adolescence. 4. Infancy. The correct answer is 2. Young adulthood. Rationale: young adults, 18 to 25 years. Intimacy versus isolation. Strive to establish mature relationships, commit to suitable partners, and develop social and work roles acceptable to society. Unsuccessful resolution results in self-absorption, egocentricity, and emotional isolation. Middle-aged adults, 25 to 45 years. Generativity versus stagnation. Strive to fulfill life goals associated with family, career, and society, as well as to give to and care for others. Adolescence, 12 to 20 years. Identity versus role confusion. Strive to make the transition from childhood to adulthood with a sense of personal self. Infants, newborn to 18 months. Trust versus mistrust. Strive to have their needs met through interacting with others. When their needs are consistently met, they develop a sense of trust in their caregivers.
The nurse is administering a beta blocker to the client diagnosed with essential hypertension. Which intervention should the nurse implement? 1. Notify the healthcare provider if the potassium level is 3.8 milliequivalents per liter. 2. Question administering the medication if the BP is less than 90/60. 3. Do not administer the medication if the client's radial pulse is greater than 100 beats per minute. 4. Monitor the client's BP while he or she is lying, standing, and sitting. The correct answer is 2. Question administering the medication if the BP is less than 90/60. The nurse should question administering the beta blocker if the BP is low, because this medication will cause the blood pressure to drop even lower, leading to hypotension. The potassium level is within normal limits, and it is not usually checked prior to administering beta blockers. The nurse would not administer the medication if the apical pulse were less than 60 beats per minute. The nurse needs to assess the blood pressure only once prior to administering the medication.
The nurse is caring for a patient who was recently admitted for severe diverticulitis. Which task is appropriate to delegate or assign for the care of this patient? 1. Tell the unit secretary to call radiology and schedule a barium enema. 2. Ask the LPN/LVN to give as needed laxatives for constipation. 3. Instruct the nursing student to help the patient ambulate up and down the hall. 4. Tell assistive personnel to save a stool specimen to test for occult blood. The correct answer is 4. Tell assistive personnel to save a stool specimen to test for occult blood. Rationale: diverticulitis can cause chronic or severe bleeding, so if there is no obvious blood in the stool may be tested for occult blood. A barium enema is not usually ordered because of the danger of perforation. Laxatives and ambulation increase intestinal motility and are to be avoided in the initial phase of treatment. If a barium enema, PRN laxative, or ambulation is prescribed, the nurse should check with a healthcare provider before delegating or assigning the intervention. A nurse must collect information about a community to identify its needs, which is the most significant assessment by the nurse. 1. The demographics of the community. 2. What the community thinks is important. 3. How many support services are available. 4. Environmental data as they relate to public safety. The correct answer is 2. What the community thinks is important. Rationale: the members in the community are the primary source of data about the community and its needs. Just as the client is the center of the healthcare team when caring for an individual, the collective membership of a community is the center of the healthcare team when caring for the healthcare needs of a community.
The nurse is teaching a client with newly diagnosed type 1 diabetes about insulin therapy. Which statements indicate the client needs more teaching concerning insulin therapy? Select all that apply. 1. If I have a headache or start getting nervous, I will drink some orange juice. 2. If I pass out at home, a family member should give me a glucagon injection. 3. Because I am taking my insulin daily, I do not have to adhere to a diabetic diet. 4. I will check my blood glucose with my glucometer at least once a day. 5. I should administer my insulin in my abdomen for best absorption. The correct answer is 3. Because I am taking my insulin daily, I do not have to adhere to a diabetic diet. Even with insulin therapy, the client should adhere to the American Diabetic Association diet, which recommends carbohydrate counting. The statement in option 3 indicates the client needs more teaching. Headache, nervousness, sweating, tremors, and rapid pulse are signs of a hypoglycemic reaction and should be treated with a simple acting carbohydrate, such as orange juice, sugar-containing drinks, and hard candy. If a client cannot drink or eat a simple carbohydrate for hypoglycemia, then the client should receive a glucagon injection to treat the hypoglycemic reaction. Monitoring and documenting the blood glucose level is encouraged to determine the effectiveness of the treatment regimen. The abdominal area best absorbs insulin. Therefore, the client does not need more teaching. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
A hospice nurse is providing emotional support for 8 young children of a dying mother. At which age do children first recognize that death is irreversible, universal, and natural? 1. 9 years of age. 2. 6 years of age. 3. 15 years of age. 4. 12 years of age. The correct answer is 1. 9 years of age. Rationale. A 9-year-old child has a more realistic understanding of death than a younger child and recognizes that death is universal, irreversible, and natural. A 9-year-old child has a beginning knowledge of his or her own mortality and may fear death. A 6-year-old child is developing an understanding of the differences among the concepts of past, present, and future. A 6-year-old child believes that death is temporary, can be caused by bad thoughts, and may be a punishment, and that magic can make the dead person alive. Recognizing that death is irreversible, universal, and natural occurs at an earlier age than 15 years. Recognizing that death is irreversible, universal, and natural occurs at an earlier age than 12 years.
The nurse is teaching the client recently diagnosed with essential hypertension. Which instruction should the nurse provide when discussing exercise? 1. Walk at least 30 minutes a day on flat surfaces. 2. Perform light weightlifting 3 times a week. 3. Recommend high-level aerobics daily. 4. Encourage the client to swim laps once a week. The correct answer is 1. Walk at least 30 minutes a day on flat surfaces. Walking 30 to 45 minutes a day will help to reduce blood pressure, weight, and stress, and will increase a feeling of overall well-being. Isometric exercises should be discouraged because performing them can raise the systolic blood pressure. The client should walk, cycle, jog, or swim daily, but high-level aerobic exercise may increase the client's blood pressure. Swimming laps is recommended, but it should be daily, not once a week.
A patient underwent an exploratory laparotomy 2 days ago. The healthcare provider should be called immediately for which assessment finding: 1. Abdominal distension and rigidity. 2. Absent or hypoactive bowel sounds. 3. Nausea and occasional vomiting. 4. Displacement of the nasogastric tube. The correct answer is 1. Abdominal distension and rigidity. Rationale. Distension and rigidity can signal hemorrhage or peritonitis. The HCP may also decide that these symptoms require medication to stimulate peristalsis. Absence of bowel sounds is expected within the first 24 to 48 hours. Nausea and vomiting are not uncommon and are usually self-limiting, and an as-needed prescription for an antiemetic is usually part of the routine postoperative care. The NG tube should be assessed for displacement, and the correct position of the tube must be confirmed. The nurse then secures the tube as necessary. A family member requests relief from caring for a relative who has a history of excessive intake of alcohol and a rapidly debilitating malignancy. To which resource should the nurse refer the family member for respite care? 1. Hospice. 2. Meals on Wheels. 3. Ambulatory Care Center. 4. Substance Misuse Treatment Center. The correct answer is 1. Hospice. Rationale. A hospice program is an example of an agency that may provide or arrange for respite care in a healthcare facility or in the home. The caregiving role is physically and emotionally grueling, and family members may need relief from the caregiving role or a break to attend a family function or go on vacation. Meals on Wheels does not provide respite care. It provides nutritious, low-cost meals for homebound people so that they can remain in their own homes. Ambulatory care centers do not provide respite care. Ambulatory care centers provide care for people with conditions that do not require hospitalization. Services may include diagnosis and treatment of disease and illness, as well as simple surgical procedures in which the client returns home the same day. A substance misuse treatment center does not provide respite care. It provides a specialized service in the care and treatment of individuals who misuse alcohol or drugs.
The nurse administered 25 units of insulin isophane to a client with type 1 diabetes at 1600 hour. Which intervention should the nurse implement? 1. Assess the client for hypoglycemia around 1800 hour. 2. Ensure the client eats the nighttime snack. 3. Check the client's serum blood glucose level. 4. Serve the client the supper tray. The correct answer is 2. Ensure the client eats the nighttime snack. The nurse needs to ensure the client eats the nighttime snack to help prevent nighttime hypoglycemia. Insulin isophane is an intermediate-acting insulin that peaks 6 to 8 hours after administration. Therefore, the client would experience signs of hypoglycemia around 2200 hour to 2400 hour. A serum blood glucose level would have to be done with a venipuncture, and the blood sample must be taken to the laboratory. If the client needed the blood glucose checked, it should be done with a glucometer at the bedside. The supper tray would not help prevent a hypoglycemic reaction because the insulin isophane humulin N is an intermediate-acting insulin that peaks in 6 to 8 hours.
A nurse is planning a teaching session for an older adult about a prescribed medication regimen, which is a major concern about older adults that the nurse should consider. 1. They experience an increase in absorption of drugs from the gastrointestinal tract. 2. They are less motivated to follow a prescribed drug regimen. 3. They are less likely to learn due to a decline in intelligence. 4. They have a decreased risk for adverse reactions to drugs. The correct answer is 2. They are less motivated to follow a prescribed drug regimen. Rationale. The literature documents that older adults are at high risk for non-adherence to a medication regimen because of its complexity. The larger the number of medications and the larger the number of doses per day, the higher the risk of non-adherence. One study indicated that the adherence rate was 87% for daily dosing, 81% for doses twice a day, 77% for doses 3 times a day, and 39% for doses 4 times a day. Other reasons for not fully adhering to a drug regimen include inconvenience, side effects, financial limitations, and/or perceived ineffectiveness of the drugs.
The nurse is caring for a 3-month-old being evaluated for possible Hirschsprung disease. His parents call the nurse and show her his diaper containing a large amount of mucus and bloody diarrhea. The nurse notes that the infant is irritable and his abdomen appears very distended. Which should be the nurse's next action? 1. Reassure the parents that this is an expected finding and not uncommon. 2. Call a code for a potential cardiac arrest and stay with the infant. 3. Immediately obtain all vital signs with a quick head-to-toe assessment. 4. Obtain a stool sample for occult blood. The correct answer is 3. Immediately obtain all vital signs with a quick head-to-toe assessment. All vital signs need to be evaluated because the child with enterocolitis can quickly progress to a state of shock. A quick head-to-toe assessment will allow the nurse to evaluate the child's circulatory system. All cases of bloody diarrhea need to be evaluated because this may be a sign of enterocolitis, which is a potentially fatal complication of Hirschsprung disease. For option 2, although this is a potentially critical complication, calling a code is not necessary at this time because the infant is irritable and not unconscious. It is not a priority to test the stool for occult blood because there is obvious blood in the sample. You should select answer 3 because there is not enough information to determine the status of the child. Obtaining vital signs will help the nurse to assess the situation. The client diagnosed with inflammatory bowel disease, taking mesalamine reports, nausea, vomiting, and diarrhea. Which intervention should the clinic nurse take? 1. Instruct the client to quit taking the medication immediately. 2. Tell the client to take lansoprazole with the medication. 3. Advise the client to keep taking the medication, but notify the HCP. 4. Explain that these symptoms are expected and will resolve with time. The correct answer is 3. Advise the client to keep taking the medication, but notify the HCP. Mesalamine is an aspirin derivative. These are side effects of the medication, and the HCP should be notified, but the client should not stop taking the medication. The client should not quit taking the medication abruptly because that would result in an acute exacerbation of the inflammatory bowel disease. Lansoprazole is a PPI. A PPI will not help treat these symptoms. These symptoms will not resolve with time and should be reported to the HCP.
Which concept is reflective of Erik Erikson's theory of personality development? 1. Defense mechanisms help people to cope with anxiety. 2. Moral maturity is a central theme in all stages of development. 3. Achievement of developmental goals is affected by the social environment. 4. 2 continual processes, assimilation and accommodation, stimulate intellectual growth. The correct answer is 3. Achievement of developmental goals is affected by the social environment. Rationale. Erik Erikson expanded on Freud's theory of personality development by giving equal emphasis to the influence of a person's social and cultural environment. He stressed that psychosocial development depends on an interactive process between the physical and emotional variables during a person's life at 8 distinct stages. Each stage requires resolution of a developmental conflict that has opposite outcomes, and that requires interaction within the self and with others in the environment. Sigmund Freud, not Erik Erikson, identified that defense mechanisms are used to reduce anxiety by preventing conscious awareness of threatening thoughts or feelings. Lawrence Kohlberg, not Erik Erikson, established a framework for understanding the development of moral maturity, which is the ability to recognize independently what is right and what is wrong. Assimilation and accommodation of new information necessary to stimulate intellectual growth comprise a concept basic to Jean Piaget's theory of cognitive development, not Erikson's theory of personality development. Assimilation involves the process of organizing new information into one's present body of knowledge, and accommodation involves rearranging and restructuring thought processes to deal with the imbalance caused by new information and thereby increase understanding.
The nurse is caring for an infant newly diagnosed with Hirschsprung disease. What does the nurse understand about this infant's condition? Select all that apply. 1. There is a lack of peristalsis in the large intestine and an accumulation of bowel contents, leading to abdominal distension. 2. There is excessive peristalsis throughout the intestine, resulting in abdominal distension. 3. There is a small bowel obstruction, leading to ribbon-like stools. 4. There is inflammation throughout the large intestine, leading to accumulation of intestinal contents and abdominal distension. 5. There is an accumulation of bowel contents, leading to non-passage of stools. The correct answers are 1. There is a lack of peristalsis in the large intestine and an accumulation of bowel contents, leading to abdominal distension, and 5. There is an accumulation of bowel contents, leading to non-passage of stools. In Hirschsprung disease, a portion of the large intestine has an area lacking in ganglion cells. This results in a lack of peristalsis, as well as an accumulation of bowel contents and abdominal distension. There is accumulation of stool above the aganglionic bowel, which does not allow stool to pass through. There is a lack of peristalsis at the aganglionic section of the bowel. Hirschsprung disease does not include a small bowel obstruction. Hirschsprung disease does not present with inflammation throughout the large intestine. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The client diagnosed with a severe acute exacerbation of Crohn's disease is prescribed total parenteral nutrition, TPN. Which interventions should the nurse implement when administering TPN? Select all that apply. 1. Monitor the client's glucose level every 6 hours. 2. Administer the TPN on an IV pump. 3. Assess the peripheral IV site every 4 hours. 4. Check the TPN according to the 6 rights prior to administering. 5. Encourage the client to eat all of the food offered at meals. The correct answers are 1. Monitor the client's glucose level every 6 hours. 2. Administer the TPN on an IV pump. And 4. Check the TPN according to the 6 rights prior to administering. TPN is 50% dextrose. Therefore, the client's blood glucose level should be checked every 6 hours. Sliding scale regular insulin coverage is usually ordered. TPN should always be administered using an IV pump and not via gravity. Fluid volume resulting from an overload of TPN could cause a life-threatening hyperglycemic crisis. TPN must be administered via a subclavian line because a peripheral line will collapse as a result of the hyperosmolarity of the TPN and phlebitis may occur. The client with severe acute exacerbation of Crohn's is NPO to rest the bowel. When on TPN, the client is usually NPO because the TPN provides all necessary nutrients. Therefore, the nurse would not encourage the client to eat food.
A 70-year-old client tells the nurse about experiencing problems with sleep and requests sleeping medication. Which concept associated with drug therapy and quality of sleep is important for the nurse to explain when providing nursing care for this client? 1. Sedatives are not well tolerated by older adults. 2. Anti-anxiety drugs are the least helpful to support sleep. 3. Effectiveness of hypnotics increases with prolonged use. 4. Melatonin is a drug of choice for long-term use in sleep disorders. The correct answer is 1. Sedatives are not well tolerated by older adults. Rationale. Sedatives are not well tolerated by older adults because a decrease in the metabolism and excretion of the drug can result in toxicity. In addition, older adults may experience idiosyncratic effects. Anti-anxiety drugs depress the central nervous system and therefore are helpful in supporting sleep. The effectiveness of hypnotics decreases, not increases, with prolonged use. They should be used only as a short-term intervention because tolerance and rebound insomnia occur in approximately 4 weeks. Although melatonin demonstrates promise as a drug to support sleep, it is not the drug of choice because its safety and efficacy for long-term use are not yet established.
The nurse is caring for an infant diagnosed with Hirschsprung disease. The mother states she is pregnant with a boy and wants to know if her new baby will likely have the disorder. Which is the nurse's best response? 1. Genetics play a small role in Hirschsprung disease, so there is a chance the baby will develop it as well. 2. There is no evidence to support a genetic link, so it is very unlikely the baby will also have it. 3. It is rarely seen in boys, so it is not likely your new baby will have Hirschsprung disease. 4. Hirschsprung disease is seen only in girls, so your new baby will not be at risk. The correct answer is 1. Genetics play a small role in Hirschsprung disease, so there is a chance the baby will develop it as well. There is a genetic component to Hirschsprung disease, so any future siblings are also at risk. Hirschsprung disease is seen in both males and females, but is more common in males. You can eliminate answers 3 and 4 because they are similar and therefore would not likely be the correct answer. The client diagnosed with severe ulcerative colitis is prescribed azathioprine. Which assessment data concerning the medication warrants immediate intervention by the nurse? 1. Reports of a sore throat, fever, and chills. 2. Reports of 10 to 20 loose stools a day. 3. Reports of abdominal pain and tenderness. 4. Reports of dry mouth and oral mucosa. The correct answer is 1. Reports of a sore throat, fever, and chills. Azathioprine is an immunosuppressant and can cause a decrease in the number of blood cells in the bone marrow. Signs or symptoms that would warrant intervention by the nurse include sore throat, fever, chills, unusual bleeding or bruising, pale skin, headache, confusion, tachycardia, insomnia, and shortness of breath. 10 to 20 loose, watery stools a day are characteristic of an acute exacerbation of ulcerative colitis and would not warrant intervention by the nurse secondary to the medication. Abdominal pain and tenderness are characteristic of an acute exacerbation of ulcerative colitis and would not warrant intervention by the nurse secondary to the medication. Dehydration may occur with ulcerative colitis, but it does not warrant intervention by the nurse secondary to the medication.
When the nurse assesses an adult client, which client behavior may indicate an unresolved developmental task of infancy? 1. Avoiding assistance from others. 2. Rationalizing unacceptable behaviors. 3. Being overly concerned about cleanliness. 4. Apologizing constantly for small mistakes. The correct answer is 1. Avoiding assistance from others. Rationale. People who avoid help from others and who would rather do things themselves generally have not completely resolved the developmental task of trust versus mistrust during infancy. Rationalizing unacceptable behaviors is a defense mechanism, not an indication of an unresolved developmental task of infancy. Rationalization is used to justify in some socially acceptable way ideas, feelings, or behavior through explanations that appear to be logical. Option 3 relates more to the anal stage of Freud's psychosexual theory of development. Freud believed that when toilet training is approached in a rigid and demanding manner, a child develops into an adult who is overly concerned with orderliness and cleanliness. Option 4 indicate an unresolved conflict of autonomy versus shame and doubt associated with the 18-month to 3-year-old age group. One of the developmental tasks of this age group is learning right from wrong. When parents are overly critical and controlling, a child may be overly self-judgmental and become an adult who feels the need to apologize for small mistakes constantly.
Which instructions for a child diagnosed with encopresis should the nurse question? Select all that apply. 1. Limit the intake of milk. 2. Offer a diet high in protein. 3. Obtain a complete dietary log. 4. Follow up with a child psychologist. 5. After dinner, have the child sit on the toilet for 10 minutes. The correct answers are 2. Offer a diet high in protein, and 4. Follow up with a child psychologist. A diet high in protein will cause more constipation. The child and family would not be encouraged initially to seek counseling unless a psychological component to the encopresis had been identified. Dairy products are limited because they can lead to constipation. A complete dietary log should be kept to correlate the foods that lead to constipation. Children with constipation/encopresis are advised to sit on the toilet for 10 minutes after dinner to take advantage of the gastrocolic reflex. The client diagnosed with inflammatory bowel disease is prescribed sulfasalazine. Which intervention should the nurse implement when administering this medication? 1. Ensure the client drinks at least 2,000 milliliters of water daily. 2. Administer the medication once a day with breakfast. 3. Explain that the medication may cause slight bruising. 4. Assess the client's stool for steatorrhea and mucus. The correct answer is 1. Ensure the client drinks at least 2,000 milliliters of water daily. Sulfasalazine is a sulfonamide antibiotic. Increasing fluid intake dilutes the drug, which helps to prevent crystalluria from occurring. The medication is administered every 6 to 8 hours, not once a day. Instruct the client to report any bruising or bleeding because it could be a sign of a drug-induced blood disorder. This medication will not cause fat, frothy stools. Therefore, the nurse does not need to assess the stool.
A nurse in a clinic is caring for clients in a variety of age groups. Which age group should the nurse anticipate will have the highest potential to demonstrate regression when ill? 1. Infants. 2. Toddlers. 3. Adolescents. 4. Young adults. The correct answer is 2. Toddlers. Rationale. Toddlers are less able to understand and interpret what is happening to them when ill. Therefore, they commonly regress to a previous level of development in an attempt to reduce anxiety. Infants already demonstrate behavior on the most basic level. Adolescents generally want to behave in an adult manner, and therefore demonstrate a controlled behavioral response to illness. Although some young adults may regress to an earlier level of development as a coping strategy, regression commonly is not used as a defense mechanism when coping with illness.
A child is diagnosed with chronic constipation that has been unresponsive to dietary and activity changes. Which pharmacological measure is most appropriate? 1. Natural supplements and herbs. 2. Stimulant laxative. 3. Osmotic agent. 4. Pharmacological measures are not used in pediatric constipation. The correct answer is 3. Osmotic agent. A stool softener is the drug of choice because it will lead to easier evacuation. Natural supplements and herbs are not recommended because the safety and efficacy are not standardized. A stimulant laxative is not the drug of choice because it may increase abdominal discomfort and may lead to dependency. Although diet and activity modification are tried first, medications are sometimes needed. You should eliminate answer 4 because it implies that medications are never given to the constipated child. In healthcare, there are very few cases of never and always. The client diagnosed with ulcerative colitis is prescribed mesalamine. Which information should the nurse discuss with the client? 1. Explain to the client that undissolved tablets may be expelled in stool. 2. Discuss the importance of taking the medication on an empty stomach only. 3. Tell the client to avoid drinking any type of carbonated beverages. 4. Instruct the client not to crush, break, or chew the tablets or capsules. The correct answer is 4. Instruct the client not to crush, break, or chew the tablets or capsules. Mesalamine is an aspirin derivative. The tablets must be swallowed whole because they are specially formulated to release the medication after it has passed through the stomach. The client should notify the HCP if undissolved tablets or capsules are found in the stool because this is not expected. This medication can be taken with or without food. Food does not affect the effectiveness of the medication. There are no restrictions on foods, beverages, or activities when taking this medication unless the HCP directs otherwise.
The 44-year-old female client presents to the emergency department diagnosed with a stroke. Which of the client's current medication regimen is a risk factor for developing a stroke? 1. Propranolol. 2. Furosemide. 3. Estradiol/norgestimate. 4. Metformin. The correct answer is 3. Estradiol/norgestimate. Rationale: propranolol, a beta blocker, is administered for cardiac dysrhythmias and hypertension and for migraine headache prophylaxis. The medication could help prevent a stroke by lowering the blood pressure. Furosemide is a loop diuretic. Loop diuretics have an indirect ability to lower the blood pressure by decreasing the volume of fluid in the body. This would decrease the risk of a stroke. Estradiol/norgestimate is a combination hormone used to prevent conception. Combination oral contraceptives have been associated with venous and arterial thromboembolism, pulmonary embolism, myocardial infarction, and thrombotic stroke. Adverse reaction to metformin glucophage, a biguanide, is lactic acid buildup, not stroke.
The charge nurse is doing shift assignments for the medical floor. Which client should be assigned to the most experienced nurse? 1. The client diagnosed with congestive heart failure who is being discharged in the morning. 2. The client who is having frequent incontinent liquid bowel movements and vomiting. 3. The client with an apical pulse rate of 116, a respiratory rate of 26, and a blood pressure of 94/62. 4. The client who is complaining of chest pain with inspiration and a non-productive cough. The correct answer is 3. The client with an apical pulse rate of 116, a respiratory rate of 26, and a blood pressure of 94/62. The client in option 3 is exhibiting signs and symptoms of shock, which makes this client the most unstable. An experienced nurse should care for this client. The client in option 1 is stable because discharge is scheduled for the following day. Therefore, this client does not need to be assigned to the most experienced nurse. The client in option 2 is more in need of custodial nursing care than care from the most experienced nurse. Therefore, the charge nurse could assign a less experienced nurse to this client. The complaints in option 4 usually indicate muscular or pleuritic chest pain. Cardiac chest pain does not fluctuate with inspiration. This client does not require the care of an experienced nurse as much as does the client with signs of shock.
What question is a home health nurse most likely to ask the patient to evaluate the efficacy of cimetidine? 1. Are you still having problems with constipation? 2. Has the medication helped to relieve the acid indigestion? 3. Did the medication relieve the nausea and vomiting? 4. Do you feel like your appetite has improved? The correct answer is 2. Has the medication helped to relieve the acid indigestion? Rationale: cimetidine is available over the counter and is used to relieve heartburn, acid indigestion, and sour stomach.
The nurse receives a call from the parent of a 10-month-old who has vomited 3 times in the past 8 hours. The parent describes the baby as playful and wanting to drink. The parent asks the nurse what to give the child. Select the nurse's best response. 1. Replace the next feeding with regular water and see if that is better tolerated. 2. Do not allow your baby to eat any solids. Give half the normal formula feeding and see if that is better tolerated. 3. Do not let your baby eat or drink anything for 24 hours to give the stomach a chance to rest. 4. Give your child 0.5 ounce of Pedialyte every 10 minutes. If vomiting continues, wait an hour and then repeat what you previously gave. The correct answer is 4. Give your child 0.5 ounce of Pedialyte every 10 minutes. If vomiting continues, wait an hour and then repeat what you previously gave. Offering small amounts of clear liquids is usually well tolerated. If the child vomits, make them NPO for an hour to allow the stomach to rest and then restart fluids. The child in this scenario is described as playful and therefore does not appear to be at risk for dehydration. Free water should not be given because it does not contain any electrolytes and can lead to critical electrolyte imbalances. Formula should be avoided, and clear liquids such as Pedialyte should be offered. 24 hours is too long for the infant to remain NPO. The infant needs to drink a rehydration solution, such as Pedialyte, in order to avoid severe dehydration. You should eliminate answers 1 and 3 because they could cause harm to the infant. The nurse is discharging a client 2 days post-operative hiatal hernia repair. Which discharge instructions should the nurse include? Select all that apply. 1. Take all of the prescribed antibiotic. 2. Eat 6 small meals per day. 3. Use the legs to bend down, not the back. 4. Take esomeprazole twice a day. 5. Use the pain medication when the pain is at 8 through 10. The correct answers are 1. Take all of the prescribed antibiotic. 2. Eat 6 small meals per day. And 3. Use the legs to bend down, not the back. Prophylactic antibiotics are frequently prescribed both pre-surgery and post-surgery. The client should be instructed to take all the medication as directed. Hiatal hernia repair may not last, and the client should continue the recommended lifestyle modifications, such as eating small meals. Part of the lifestyle modifications for hiatal hernia is to limit pressure on the abdominal cavity, especially after a meal. Using the leg muscles to bend down, rather than bending over, should be taught to the client. Esomeprazole is administered daily, not twice a day. For the best relief, pain medication should be taken at the onset of the pain. The client should not wait until the pain is an 8 to 10 before taking the pain medication. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
A hospitalized client who is being treated for hypertension with furosemide, atenolol, and ramipril develops a second-degree heart block Mobitz type 1. Which of the following actions should the nurse take? 1. Administer a 250 milliliters fluid bolus. 2. Withhold atenolol. 3. Prepare for cardioversion. 4. Set up for an arterial line. The correct answer is 2. The client may be asymptomatic, and the underlying cause should be assessed. Drugs that block the AV node should be avoided, such as beta blockers, calcium channel blockers, digoxin, and amiodarone. Symptomatic clients are treated with atropine and transcutaneous pacing. There is no indication for a fluid bolus, cardioversion, or arterial line.
Which child can be discharged without further evaluation? 1. A 2-year-old who has had 24 hours of watery diarrhea that has changed to bloody diarrhea in the past 12 hours. 2. A 3-year-old who had a relapse of 1 diarrhea episode after restarting a normal diet. 3. A 6-year-old who has been having vomiting and diarrhea for 2 days and has decreased urine output. 4. A 10-year-old who has just returned from a scout camping trip and has had several episodes of diarrhea. The correct answer is 2. A 3-year-old who had a relapse of 1 diarrhea episode after restarting a normal diet. It is common for children to have a relapse of diarrhea after resuming a regular diet. Diarrhea containing blood needs further evaluation to determine the source of the blood, and the child's blood counts and electrolyte balance need to be tested. Children who have had vomiting and diarrhea for more than 2 days require evaluation to determine whether IV rehydration and hospital admission are necessary. Diarrhea following a camping trip needs further evaluation because it may be caused by bacteria or parasites. You should eliminate answers 1 and 3 because they describe children who may have altered electrolytes and blood counts due to prolonged diarrhea. The nurse is discharging a client diagnosed with gastroesophageal reflux disease. Which information should the nurse include in the teaching? 1. There are no complications of gastroesophageal reflux disease as long as you take the medications. 2. Notify the HCP if the medication does not resolve the symptoms. 3. Immediately after a meal, lie down for at least 45 minutes. 4. If any discomfort is noted, take an NSAID for the pain. The correct answer is 2. Notify the HCP if the medication does not resolve the symptoms. There may be several complications of gastroesophageal reflux disease. Adult-onset asthma and Barrett's esophagus leading to cancer of the esophagus are 2 complications of gastroesophageal reflux disease. The chance of developing these problems is less if the GERD is adequately treated, but there are no guarantees. The client should be instructed to sit upright for at least 60 minutes following a meal to prevent reflux from occurring. NSAIDs can increase gastric distress. Ulcers caused by NSAIDs use may be asymptomatic, or the symptoms may be attributed to the GERD. The client should use the prescribed H2 receptor blocker, PPI, or an antacid to relieve the discomfort associated with gastroesophageal reflux disease.
The nurse is developing a care plan with an older adult with hypertension and is instructing the client that hypertension can be a silent killer. The nurse should instruct the client to report signs of which of the following diseases that are often a result of undetected high blood pressure. 1. Cerebrovascular accidents. 2. Liver disease. 3. Myocardial infarction. 4. Pulmonary disease. The correct answer is 1. Hypertension is referred to as a silent killer for adults because until the adult has significant damage to other systems, the hypertension may go undetected. CVAs can be related to long-term hypertension. Liver or pulmonary disease is not generally associated with hypertension. Myocardial infarction is generally related to coronary artery disease.
The nurse is caring for a 9-month-old with diarrhea secondary to rotavirus. The child has not vomited and is mildly dehydrated, which is likely to be included in the discharge teaching. 1. Administer loperamide as needed. 2. Administer bismuth subsalicylate as needed. 3. Continue breastfeeding per routine. 4. The infant may return to day care 24 hours after antibiotics have been started. The correct answer is 3. Continue breastfeeding per routine. Breastfeeding is usually well tolerated and helps prevent death of intestinal villi and malabsorption. Antibiotics are not effective in viruses. Children should not return to daycare while they are still having diarrhea. Loperamide slows intestinal motility and allows overgrowth of organisms and should therefore be avoided. Bismuth subsalicylate slows intestinal motility and allows overgrowth of organisms and should therefore be avoided. You can eliminate answer 4 because antibiotics are not effective with viruses such as rotavirus. Answers 1 and 2 can be eliminated because antidiarrheal agents are not recommended in the pediatric population. The nurse is preparing to administer esomeprazole. Which intervention should the nurse implement? Select all that apply. 1. Order an infusion pump for the client. 2. Elevate the client's head of the bed. 3. Check the client's ID with the medication administration record. 4. Check for allergies to cephalosporin. 5. Ask the client his or her date of birth. The correct answers are 2. Elevate the client's head of the bed. 3. Check the client's ID with the medication administration record. And 5. Ask the client his or her date of birth. The head of the bed is elevated for the client to be able to swallow the medication. The nurse must check the medication administration record with the client's ID band to ensure the correct client is receiving the medication. The Joint Commission requires that 2 patient identifiers be used to determine the right patient. Most healthcare facilities use the client's name and date of birth as these identifiers. An IV pump is not needed. Esomeprazole is a PPI, not a cephalosporin. Cephalosporins are a class of antibiotics.
The client has had hypertension for 20 years. The nurse should assess the client for 1. Renal insufficiency and failure. 2. Valvular heart disease. 3. Endocarditis. 4. Peptic ulcer disease. The correct answer is 1. Renal disease, including renal insufficiency and failure, is a complication of hypertension. Effective treatment of hypertension assists in preventing this complication. Valvular heart disease, endocarditis, and peptic ulcer disease are not complications of hypertension.
The parent of a 5-year-old states that the child has been having diarrhea for 24 hours, vomited twice 2 hours ago, and now claims to be thirsty. The parent asks what to offer the child because the child is refusing Pedialyte. Which is the nurse's most appropriate response? 1. You can offer clear diet soda such as Sprite and ginger ale. 2. Pedialyte is really the best thing for your child, who, if thirsty enough, will eventually drink it. 3. Pedialyte is really the best thing for your child. Allow your child some choice in the way to take it by offering small amounts in a spoon, medicine cup, or syringe. 4. It really does not matter what your child drinks as long as it is kept down. Try offering small amounts of fluids in medicine cups. The correct answer is 3. Pedialyte is really the best thing for your child. Allow your child some choice in the way to take it by offering small amounts in a spoon, medicine cup, or syringe. Pedialyte is the first choice, as recommended by the American Academy of Pediatrics. Offering the child appropriate choices may allow the child to feel empowered and less likely to refuse the Pedialyte. Small, frequent amounts are usually better tolerated. When Pedialyte is not tolerated, it is usually recommended that clear sodas and juices be diluted. Diet beverages are not recommended because the sugar is needed to help the sodium be reabsorbed. Pedialyte is the best choice. If the child is not encouraged to drink Pedialyte, the child may become severely dehydrated. Other ways to encourage oral rehydration need to be considered. Offering small amounts of liquids is important. The type of beverage does matter because many fluids may increase vomiting and diarrhea. You should eliminate answer 2 because it offers an ultimatum to a child. The child is likely to refuse the Pedialyte, worsening the state of dehydration. The home healthcare nurse is caring for a male client diagnosed with a hiatal hernia and reflux. Which data indicates the medication therapy is effective? 1. The client takes the antacid 1 hour before and 3 hours after a meal. 2. The client reports indigestion after eating a large meal. 3. The client states that he did not wake up with heartburn during the night. 4. The client has lost 3 pounds in the past 2 weeks. The correct answer is 3. The client states that he did not wake up with heartburn during the night. Option 3 indicates an improvement in symptoms and that the medication is effective. Option 1 indicates client compliance with the dosing regimen for antacids, not that the medication is effective. The return of symptoms in Option 2 indicates the medication is not effective. In Option 4, losing weight would not indicate that a medication for hiatal hernia is effective.
When teaching a client about propranolol hydrochloride, the nurse should base the information on the knowledge that propranolol 1. Blocks beta-adrenergic stimulation and thus causes decreased heart rate, myocardial contractility, and conduction. 2. Increases norepinephrine secretion and thus decreases blood pressure and heart rate. 3. Is a potent arterial and venous vasodilator that reduces peripheral vascular resistance and lowers blood pressure. 4. Is an angiotensin-converting enzyme inhibitor that reduces blood pressure by blocking the conversion of angiotensin 1 to angiotensin 2. The correct answer is 1. Propranolol is a beta-adrenergic blocking agent. Actions of propranolol include reducing heart rate, decreasing myocardial contractility, and slowing conduction. Propranolol does not increase norepinephrine secretion, cause vasodilation, or block conversion of angiotensin 1 to angiotensin 2.
The nurse is caring for a 2-year-old child who was admitted to the pediatric unit for moderate dehydration due to vomiting and diarrhea. The child is restless with periods of irritability. The child is a febrile with a heart rate of 148 and a blood pressure of 90/42. Baseline laboratory tests reveal the following: sodium 152, chloride 119, and glucose 115. The parents state that the child has not urinated in 12 hours. After establishing a saline lock, the nurse reviews the physician's orders. Which order should the nurse question? 1. Administer a saline bolus of 10 milliliters per kilogram, which may be repeated if the child does not urinate. 2. Recheck serum electrolytes in 12 hours. 3. After the saline bolus, begin maintenance fluids of D5 normal saline with 10 milliequivalents potassium chloride per liter. 4. Give clear liquid diet as tolerated. The correct answer is 3. After the saline bolus, begin maintenance fluids of D5 normal saline with 10 milliequivalents potassium chloride per liter. Potassium is contraindicated because the child has not yet urinated. Potassium is not added to the maintenance fluid until kidney function has been verified. The child with dehydration secondary to vomiting and diarrhea is placed on a clear liquid diet. Fluid boluses of normal saline are administered according to the child's body weight. It is not unusual to have to repeat the bolus multiple times in order to see an improvement in the child's condition. It is important to monitor serum electrolytes frequently in the dehydrated child. Which side effects should the nurse explain to the male client who is prescribed cimetidine? 1. The medication can cause indigestion and heartburn. 2. The medication can cause impotence and gynecomastia. 3. The medication can cause insomnia and hypervigilance. 4. The medication can cause Zollinger-Ellison syndrome. The correct answer is 2. The medication can cause impotence and gynecomastia. Cimetidine is an H2 blocker. Over time, cimetidine can cause males to become impotent, have decreased libido, and have breast development. Cimetidine, an H2 blocker, is used to treat indigestion and heartburn. Cimetidine can cause lethargy and somnolence, not insomnia and hypervigilance. Cimetidine is used to treat Zollinger-Ellison syndrome, a syndrome characterized by hypersecretion of gastric acid and the formation of peptic ulcers.
The client realizes the importance of quitting smoking, and the nurse develops a plan to help the client achieve this goal. Which of the following nursing interventions should be the initial step in this plan? 1. Review the negative effects of smoking on the body. 2. Discuss the effect of passive smoking on environmental pollution. 3. Establish the client's daily smoking pattern. 4. Explain how smoking worsens high blood pressure. The correct answer is 3. A plan to reduce or stop smoking begins with establishing the client's personal daily smoking pattern and activities associated with smoking. It is important that the client understands the associated health and environmental risks, but this knowledge has not been shown to help clients change their smoking behavior.
A 4-month-old is brought to the emergency department with severe dehydration. The heart rate is 198, and her blood pressure is 68/38. The infant's anterior fontanelle is sunken. The nurse notes that the infant does not cry when the intravenous line is inserted. The child's parents state that she has not held anything down in 18 hours. The nurse obtains a fingerstick blood sugar of 94. Which would the nurse expect to do immediately? 1. Administer a bolus of normal saline. 2. Administer a bolus of D10W. 3. Administer a bolus of normal saline with 5% dextrose added to the solution. 4. Offer the child an oral rehydrating solution, such as Pedialyte. The correct answer is 1. Administer a bolus of normal saline. Dehydration is corrected with the administration of an isotonic solution, such as normal saline or lactated ringer solution. Solutions containing dextrose should never be administered in bolus form because they may result in cerebral edema. Severe dehydration is not usually corrected with oral solutions. Children with altered levels of consciousness should be kept NPO. You should immediately eliminate answers 2 and 3 because they both suggest administering glucose in bolus form, which is always contraindicated in pediatric clients. Answer 4 should be eliminated because the infant is severely dehydrated and not responding to painful stimulation, which is suggested by the lack of a cry on intravenous insertion. Which statement is an advantage to administering a histamine 2 blocker rather than an antacid to a client diagnosed with gastroesophageal reflux disease? 1. Antacids are more potent than H2 blockers in relieving the symptoms of gastroesophageal reflux disease. 2. H2 blockers have more side effects than antacids. 3. H2 blockers are less expensive than antacids. 4. H2 blockers require less frequent dosing than antacids. The correct answer is 4. H2 blockers require less frequent dosing than antacids. H2 blockers require less frequent administration than do antacids, which require frequent administration 7 or more times a day for therapeutic effects. The fewer times a client is expected to take a medication, the more likely the client is to comply with a medication regimen. H2 blockers actually block the production of gastric acid and have a longer effect than an antacid. An increase in side effects would not be an advantage. Antacids are usually less expensive than H2 blockers. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
Which intervention would be most likely to assist a client with hypertension in maintaining an exercise program? 1. Giving the client a written exercise program. 2. Explaining the exercise program to the client's spouse. 3. Reassuring the client that he or she can do the exercise program. 4. Tailoring a program to the client's needs and abilities. The correct answer is 4. Tailoring or individualizing a program to the client's lifestyle has been shown to be an effective strategy for changing health behaviors. Providing a written program, explaining the program to the client's spouse, and reassuring the client that he or she can do the program may be helpful, but are not as likely to promote adherence as individualizing the program.
A 4-month-old has had vomiting and diarrhea for 24 hours. The infant is fussy, and the anterior fontanelle is sunken. The nurse notes the infant does not produce tears when crying. Which task will help confirm the diagnosis of dehydration? 1. Urinalysis obtained by bagged specimen. 2. Urinalysis obtained by sterile catheterization. 3. Analysis of serum electrolytes. 4. Analysis of cerebrospinal fluid. The correct answer is 3. Analysis of serum electrolytes. The analysis of serum electrolytes offers the most information and assists with the diagnosis of dehydration. The information obtained from a urinalysis of an infant is not as helpful as serum electrolytes. The infant has limited ability to concentrate urine, so the specific gravity is not usually affected. A urinalysis does not need to be obtained by catheterization. Although critical in diagnosing meningitis, a lumbar puncture and analysis of cerebrospinal fluid are not done to confirm dehydration. Infants have limited ability to concentrate urine, so answers 1 and 2 can be eliminated immediately. Which statement is the scientific rationale for administering a proton pump inhibitor to a client diagnosed with gastroesophageal reflux disease? 1. PPI medications neutralize the gastric secretions. 2. PPI medications block H2 receptors on the parietal cells. 3. PPI medications inhibit the enzyme that generates gastric acid. 4. PPI medications form a protective barrier against acid and pepsin. The correct answer is 3. PPI medications inhibit the enzyme that generates gastric acid. PPIs inhibit the enzyme that generates gastric acid. Antacids, not PPIs, neutralize gastric secretions. H2 blockers block receptors on the parietal cells. Mucosal barrier agents form a protective barrier against acid and pepsin.
A client diagnosed with primary hypertension is taking chlorothiazide. The nurse determines teaching about this medication is effective when the client makes the following statement. Select all that apply. 1. I will take my weight daily at the same time each day. 2. I will not drink alcoholic beverages while on this medication. 3. I will reduce salt intake in my diet. 4. I will reduce my dosage if I have severe dizziness. 5. I will use sunscreen if I have prolonged exposure to sunlight. 6. Take the drug late in the evening. The correct answers are 1, 2, 3, and 5. Chlorothiazide causes increased urination and decreased swelling and weight loss. It is important to check and record weight 2 to 3 times per week at same time of day with similar amount of clothing. Clients should not drink alcoholic beverages or take other medications without the approval of the healthcare provider. Reducing sodium intake in the diet helps diuretic drugs to be more effective and allows smaller doses to be taken. Smaller doses are less likely to cause adverse effects, and hence excessive table salt, as well as salty food, should be avoided. Chlorothiazide is a diuretic that is prescribed for lower blood pressure and may cause dizziness and faintness when the patient stands up suddenly. This can be prevented or decreased by changing positions slowly. If dizziness is severe, the healthcare provider must be notified. Diuretics may cause sensitivity to sunlight, hence the need to avoid prolonged exposure to sunlight. Use sunscreens, and wear protective clothing. Chlorothiazide causes increased urination and must be taken early in the day to decrease nighttime trips to the bathroom. Fewer bathroom trips mean less interference with sleep and less risk of falls.
The mother of a newborn asks the nurse why the infant has to nurse so frequently. Which is the best response? 1. Formula tends to be more calorically dense, and formula-fed babies require fewer feedings than breastfed babies. 2. The newborn's stomach capacity is small, and peristalsis is slow. 3. The newborn's stomach capacity is small, and peristalsis is more rapid than in older children. 4. Breastfed babies tend to take longer to complete a feeding than formula-fed babies. The correct answer is 3. The newborn's stomach capacity is small, and peristalsis is more rapid than in older children. The small stomach capacity and rapid movement of fluid through the digestive system account for the need for small, frequent feedings. The caloric content of breast milk and formula tends to be similar. Peristalsis in infants is greater than in older children. Breastfed babies and formula-fed babies do not necessarily have a difference in feeding time. You should eliminate answers 1 and 4 because they both form generalizations that are not supported by current literature. The nurse in a medical unit has received the morning report. Which medication should the nurse administer first? 1. Pantoprazole to a client on call to surgery. 2. Calcium carbonate to a client reporting indigestion. 3. Bismuth to a client diagnosed with an ulcer. 4. Famotidine to a client diagnosed with gastroesophageal reflux disease. The correct answer is 1. Pantoprazole to a client on call to surgery. Pantoprazole is a proton pump inhibitor. A medication for a client on call to surgery is a priority. The client's surgery could be delayed if the medication has not been administered when the call to surgery comes. Calcium carbonate is an antacid. This would be the second medication to administer, as this client has a report of discomfort. Bismuth is an antimicrobial. This medication is a routine medication and could be administered at any time. Famotidine is an H2 blocker. This medication is a routine medication and could be administered at any time.
An older adult with a history of hypertension is admitted with diagnosis of dehydration. The client is becoming increasingly confused and weak. The client reports taking 1 tablet of hydrochlorothiazide daily, and the prescription is written for 1/2 tablet. The nurse should obtain additional information about 1. Decreased drug half-life of the hydrochlorothiazide. 2. Decreased hepatic blood flow. 3. Increased GI activity. 4. Increased urinary elimination. The correct answer is 2. Aging causes decreased hepatic blood flow. Decreased drug metabolism, which occurs with aging, along with more drug in circulation, means the drug will remain in the body longer and produce greater drug effects. The client has also taken more drug than prescribed, increasing the opportunity for more drug action to occur. When there is decreased metabolism of drugs, an increase in the half-life will occur most especially in the older adult. In older adults, transit time is slower, allowing more drug to be absorbed. increased urinary elimination would mean that drug elimination could be higher, not lower, and accumulating in the body.
The parent of a newborn asks, "Will my baby spit out the formula if it is too hot or too cold?" Which is the nurse's best response? 1. Babies have a tendency to reject hot fluids, but not cold fluids, which could result in abdominal discomfort. 2. Babies have a tendency to reject cold fluids, but not hot fluids, which could result in esophageal burns. 3. Your baby would most likely spit out formula that was too hot, but your baby could swallow some of it, which could result in a burn. 4. Your baby is too young to be physically capable of spitting out fluids and will automatically swallow anything. The correct answer is 4. Your baby is too young to be physically capable of spitting out fluids and will automatically swallow anything. Swallowing is a reflex in neonates. Infants younger than 6 weeks cannot voluntarily control swallowing. The infant is not capable of selectively rejecting fluid because swallowing is a reflex until 6 weeks. You should eliminate answers 1, 2, and 3 because they suggest that the infant is capable of selectively rejecting fluids. The client reporting acid when lying down at night asks the nurse if there is any medication that might help. Which statement is the nurse's best response? 1. There are no medications to treat this problem, but losing weight will sometimes help the symptoms. 2. There are several over-the-counter and prescription medications available to treat this. You should discuss this with your healthcare provider. 3. Have you had any X-rays or other tests to determine if you have cancer or some other serious illness? 4. Acid reflux at night can lead to serious complications. You need to have tests done to determine the cause. The correct answer is 2. There are several over-the-counter and prescription medications available to treat this. You should discuss this with your healthcare provider. PPIs, H2 blockers, and antacids all treat the symptoms of acid reflux. The nurse should encourage the client to discuss which medication is best with the HCP. Sometimes losing weight will help relieve symptoms, but the client did not ask about lifestyle modifications. The symptoms do not indicate cancer. The nurse should not scare the client. Acid reflux can lead to complications, including adult-onset asthma that should be treated, but most HCPs will empirically treat the symptoms of acid reflux before ordering tests to determine the cause or possible complications.
A client who has diabetes is taking metoprolol for hypertension. Which of the following information should the nurse include in the teaching plan? Select all that apply. 1. These tablets should be taken with food at same time each day. 2. Do not crush or chew the tablets. 3. Notify the healthcare provider if pulse is 82 beats per minute. 4. Have a blood glucose level drawn every 6 to 12 months during therapy. 5. Use an appropriate decongestant if needed. 6. Report any fainting spells to the healthcare provider. The correct answers are 1, 2, 4, and 6. Metoprolol is a beta-adrenergic blocker indicated for hypertension, angina, and myocardial infarction. The tablet should be taken with food at same time each day. They should not be chewed or crushed. The healthcare provider should be notified if pulse falls below 50 for several days. Blood glucose should be checked regularly during therapy, since increased episodes of hypoglycemia may occur. It may mask evidence of hypoglycemia, such as palpitations, tachycardia, and tremor. Use of any OTC decongestants, asthma and cold remedies, and herbal preparations must be avoided. Fainting spells may occur due to exercise or stress, and the dosage of the drug may need to be reduced or discontinued.
A nurse is teaching a mother how to care for her 3-day-old son's circumcised penis. Which of the following actions demonstrates that the mother has learned the information? 1. The mother cleanses the glands with a cotton swab dipped in hydrogen peroxide. 2. The mother covers the glands with antifungal ointment after rinsing off any discharge. 3. The mother squeezes soapy water from the washcloth over the glands. 4. The mother replaces the dry, sterile dressing before putting on the diaper. The correct answer is 3. The mother squeezes soapy water from the washcloth over the glands. Squeezing soapy water over the penis cleanses the area without irritating the site and causing the site to bleed. Hydrogen peroxide is not used when cleansing the circumcised penis. Antifungals are not indicated in this situation. Dry dressings are not applied to the circumcised penis. It is, however, usually recommended to liberally apply petroleum jelly to the site before diapering. The petroleum jelly may be applied directly to the penis via a sterile dressing or via a petroleum jelly-impregnated gauze. The circumcised penis has undergone a surgical procedure, but to apply a dry dressing is potentially injurious. If the dressing adheres to the newly circumcised penis, the incision could bleed. You should be aware that with routine cleaning, as cited previously, circumcisions usually heal quickly and rarely become infected. The nurse is preparing to administer medications in a pulmonary unit. Which medication should the nurse administer first? 1. Prednisone for a client diagnosed with chronic bronchitis. 2. Oxygen via nasal cannula at 2 liters per minute for a client diagnosed with pneumonia. 3. Lactic acidophilus to a client receiving IVPB antibiotics. 4. Cephalexin to a client being discharged. The correct answer is 2. Oxygen via nasal cannula at 2 liters per minute for a client diagnosed with pneumonia. Oxygen is considered a medication and should be a priority whenever it is ordered. A client diagnosed with pneumonia will have some amount of respiratory compromise, and the ordered 2 liters per minute indicates a client with a chronic lung disease. This is the priority medication. Prednisone is a glucocorticoid steroid. This is an oral preparation and one that can be given daily. This is not the first medication to be administered. Lactic acidophilus is a biologic replacement and is administered to replace the good bacteria in the body destroyed by the antibiotic, but it does not need to be administered first. Cephalexin is an oral antibiotic, but this client is being discharged, indicating the client's condition has improved. This client could wait until the oxygen is initiated.
The nurse teaches a client who has recently been diagnosed with hypertension about following a low-calorie, low-fat, low-sodium diet. Which of the following menu selections would best meet the client's needs? 1. Mixed green salad with blue cheese dressing, crackers, and cold cuts. 2. Ham sandwich on rye bread and an orange. 3. Baked chicken, an apple, and a slice of white bread. 4. Hot dogs, baked beans, and celery and carrot sticks. The correct answer is 3. Processed and cured meat products, such as cold cuts, ham, and hot dogs, are all high in both fat and sodium and should be avoided on a low-calorie, low-fat, low-salt diet. Dietary restrictions of all types are complex and difficult to implement with clients who are basically asymptomatic.
Using the Neonatal Infant Pain Scale, NIPS, a nurse is assessing the pain response of a newborn who has just had a circumcision. The nurse is assessing a change in which of the following signs, symptoms. Select all that apply. 1. Heart rate. 2. Blood pressure. 3. Temperature. 4. Facial expression. 5. Breathing pattern. The correct answers are 4. Facial expression and 5. Breathing pattern. Facial expression is one variable that is evaluated as part of the NIPS. Breathing pattern is one variable that is evaluated as part of the NIPS. Although assessed in other pain scales, the heart rate is not part of the NIPS. Blood pressure is not assessed in any infant pain scale. Temperature is not assessed in any infant pain scale. You should be familiar with the pain rating scales and use them clinically because neonates cannot communicate their pain to the nurse. The scoring variables that are evaluated when assessing neonatal pain using the NIPS are facial expression, crying, breathing patterns, movement of arms and legs, and state of arousal. Other tools for assessing pain in the neonate are the Pain Assessment Tool, the Neonatal Post-Op Pain Scale, and the Premature Infant Pain Profile. The nurse is discharging a client diagnosed with COPD. Which discharge instructions should the nurse provide regarding the client's prescription for prednisone? 1. Take all the prednisone as ordered until the prescription is empty. 2. Take the prednisone on an empty stomach with a full glass of water. 3. Stop taking the prednisone if a noticeable weight gain occurs. 4. Do not abruptly discontinue taking the prednisone. The correct answer is 4. Do not abruptly discontinue taking the prednisone. Prednisone is a glucocorticoid steroid. Prednisone is not abruptly discontinued because cortisol is necessary to sustain life, and the adrenal glands stop producing cortisol while the client is taking it exogenously. Prednisone can produce gastric distress. It is given with food to minimize the gastric discomfort. Weight gain is a side effect of steroid therapy, and the client should not stop taking the medication if this occurs. This medication must be tapered off to prevent a life-threatening complication if the client is to stop the medication. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The nurse is teaching a client with hypertension about taking atenolol. The nurse should instruct the client to 1. Avoid sudden discontinuation of the drug. 2. Monitor the blood pressure annually. 3. Follow a 2-gram sodium diet. 4. Discontinue the medication if severe headaches develop. The correct answer is 1. Atenolol is a beta-adrenergic antagonist indicated for management of hypertension. Sudden discontinuation of this drug is dangerous because it may exacerbate symptoms. The medication should not be discontinued without a physician's prescription. Blood pressure needs to be monitored more frequently than annually in a client who is newly diagnosed and treated for hypertension. Clients are not usually placed on a 2-gram sodium diet for hypertension.
A baby boy is to be circumcised by the mother's obstetrician. Which of the following actions shows that the nurse is being a patient advocate? 1. Before the procedure, the nurse prepares the sterile field for the physician. 2. The nurse refuses to unclothe the baby until the doctor orders something for pain. 3. The nurse holds the feeding immediately before the circumcision. 4. After the procedure, the nurse monitors the site for signs of bleeding. The correct answer is 2. The nurse refuses to unclothe the baby until the doctor orders something for pain. The nurse is being a patient advocate because the baby is unable to ask for pain medication. The American Academy of Pediatrics has made a policy statement that pain medications be used during all circumcision procedures. Circumcision is a surgical procedure that requires a sterile field and sterile technique. The nurse is performing safe practice in this situation. If a baby feeds immediately before the circumcision, he may aspirate his feeds. This is safe practice. Making sure the baby is not hemorrhaging at the incision site is also an example of safe nursing practice. Nurses perform a variety of roles. Being a safe practitioner is an essential role of the nurse. Just as important, and quite different, however, is the role of patient advocate, that is, providing support for the rights of a client who is unable to speak for or support himself or herself. The client diagnosed with emphysema is admitted to the surgical unit for a cholecystectomy. Which post-operative interventions should the nurse implement? Select all that apply. 1. Have the patient turn, cough, and breathe deeply every 2 hours. 2. Administer oxygen to the client at 4 liters per minute. 3. Assess the surgical dressing every 4 hours. 4. Medicate frequently with morphine 15 mg IV push. 5. Use the incentive spirometer every 4 hours. The correct answers are 1. Have the patient turn, cough, and breathe deeply every 2 hours. 3. Assess the surgical dressing every 4 hours. And 5. Use the incentive spirometer every 4 hours. Clients undergoing surgery are encouraged to turn, cough, and deep breathe a minimum of every 2 hours. Clients diagnosed with chronic lung disease are frequently prescribed long-term steroid therapy. Steroids delay wound healing. The nurse should assess the wound to determine that the surgical incision is healing as desired. The client should use the incentive spirometer to help prevent pneumonia. Every 4 hours is an appropriate time span. The client should be administered oxygen at 1 to 3 liters per minute. Clients with chronic lung disease have developed carbon dioxide narcosis. High levels of carbon dioxide have destroyed the client's first stimulus for breathing. Oxygen hunger is the body's backup system for sustaining life. Administering oxygen at levels above 2 liters per minute at rest and 3 liters per minute during activity may cause the client to stop breathing.
In teaching the client with hypertension to avoid orthostatic hypotension, the nurse should emphasize which of the following instructions? Select all that apply. 1. Plan regular times for taking medications. 2. Arise slowly from bed. 3. Avoid standing still for long periods. 4. Avoid excessive alcohol intake. 5. Avoid hot baths. The correct answers are 2 and 3. Changing positions slowly and avoiding long periods of standing may limit the occurrence of orthostatic hypotension. Scheduling regular medication times is important for blood pressure management, but this aspect is not related to the development of orthostatic hypotension. Excessive alcohol intake and hot baths are associated with vasodilation.
A couple is asking the nurse whether or not their son should be circumcised. On which fact should the nurse's response be based? 1. Boys should be circumcised for them to establish a positive self-image. 2. Boys should not be circumcised because there is no medical rationale for the procedure. 3. Experts from the Centers for Disease Control and Prevention argue that circumcision is desirable. 4. A statement from the American Academy of Pediatrics asserts that circumcision is optional. The correct answer is 4. A statement from the American Academy of Pediatrics asserts that circumcision is optional. The American Academy of Pediatrics, although acknowledging that there are some advantages to circumcision, states that there is not enough evidence to suggest that all baby boys be circumcised. There is no evidence that circumcision status affects a boy's self-image. No official statements have been published regarding the rationality of performing circumcisions. The CDC has made no policy statement on circumcision. The female client is being admitted to a medical unit with a diagnosis of pneumonia. Which intervention would the nurse implement? Rank in order of performance. 1. Start an IV access line. 2. Administer the IVPB antibiotic. 3. Teach to notify the nurse of any vaginal itching. 4. Obtain sputum and blood cultures. 5. Place an identity band on the client. The correct order is 5. Place an identity band on the client. 4. Obtain sputum and blood cultures. 1. Start an IV access line. 2. Administer the IVPB antibiotic. And 3. Teach to notify the nurse of any vaginal itching. The laboratory technician who will draw the blood cultures will need the band to identify the client before drawing the specimen, and the nurse will need the band before administering the medication. Checking for the right client is one of the 6 rights of medication administration. Cultures are obtained prior to the initiation of antibiotics to prevent skewing of the results. An IV line must be initiated before the nurse can administer IV medications. IV antibiotics should be administered within 1 to 2 hours of the order being written. This should always be considered a now medication. Superinfections are a potential complication of antibiotic therapy. Vaginal yeast infections occur when the good bacteria are killed off by the antibiotic. Diarrhea from destruction of intestinal flora is also a possibility.
The nurse is discussing medications with a client with hypertension who has a prescription for furosemide daily. The client needs further education when the client states which of the following? 1. I know I should not drive after taking my Lasix. 2. I should be careful not to stand up too quickly when taking Lasix. 3. I should take the Lasix in the morning instead of before bed. 4. I need to be sure to also take the potassium supplement that the doctor prescribed along with my Lasix. The correct answer is 1. Furosemide is a diuretic often prescribed for clients with hypertension or heart failure. The drug should not affect a client's ability to drive safely. Lasix may cause orthostatic hypotension, and clients should be instructed to be careful when changing from supine to sitting to standing position. Diuretics should be taken in the morning if possible to prevent sleep disturbance due to the need to get up to void. Lasix is a loop diuretic that is not potassium sparing. Clients should take potassium supplements as prescribed and have their serum potassium levels checked at prescribed intervals.
A nurse notes that a 6-hour-old neonate has cyanotic hands and feet. Which of the following actions by the nurse is appropriate? 1. Place the child in an isolette. 2. Administer oxygen. 3. Swaddle the baby in a blanket. 4. Apply pulse oximeter. The correct answer is 3. Swaddle the baby in a blanket. The baby's extremities are cyanotic as a result of the baby's immature circulatory system. Swaddling helps to warm the baby's hands and feet. There is no evidence in the stem that would warrant placing the child in an isolette. Cyanotic hands and feet are not signs of hypoxia in the neonate. There is no evidence in the stem that would warrant monitoring with the pulse oximeter. You must be familiar with the differences between normal findings of the newborn and those of an older child or adult. Acrocyanosis, which is bluish cyanotic hands and feet, is normal in the very young neonate resulting from his or her immature circulation to the extremities. The male client diagnosed with COPD tells the nurse that he has been expectorating rusty-colored sputum. Which medication should the nurse anticipate the HCP prescribing? 1. Prednisone. 2. Nicotine. 3. Dextromethorphan. 4. Ceftriaxone. The correct answer is 4. Ceftriaxone. Ceftriaxone is an antibiotic. The client's rusty-colored sputum indicates an infection, and an antibiotic should be ordered. Rocephin is a broad-spectrum antibiotic. Prednisone is a glucocorticoid. Clients diagnosed with COPD are commonly prescribed a steroid medication to decrease inflammation in the lungs. This client should already be taking this or a similar medication. The client should quit smoking, if still smoking. A transdermal nicotine system, such as Habitrol, would be anticipated to aid the client. Dextromethorphan is an antitussive. The client may require an antitussive, but more likely would require a mucolytic to help to expectorate the thick, tenacious sputum associated with COPD.
A client with hypertensive emergency is being treated with sodium nitroprusside, nipride, in a dilution of 50 milligrams per 250 milliliters. How many micrograms of nipride are in each milliliter? Blank micrograms. The correct answer is 200 micrograms. First, calculate the number of milligrams per milliliter. You do this by dividing 50 by 250, which equals to 0.2 milligrams. So it's 0.2 milligrams per 1 milliliter. 1 milligram equals to 1,000 micrograms. So you multiply 0.2 milligrams by 1,000, which equals to 200 micrograms.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A nurse is doing a newborn assessment on a new admission to the nursery. Which of the following actions should the nurse make when evaluating the baby for developmental dysplasia of the hip? Select all that apply. 1. Grasp the baby's legs with the thumbs on the inner thighs and forefingers on the outer thighs. 2. Gently adduct and abduct the baby's thighs. 3. Palpate the trochanter during hip rotation. 4. Place the baby in a fetal position. 5. Compare the lengths of the baby's legs. The correct answers are 1. Grasp the baby's legs with the thumbs on the inner thighs and forefingers on the outer thighs. 2. Gently adduct and abduct the baby's thighs. 3. Palpate the trochanter during hip rotation. And 5. Compare the lengths of the baby's legs. With the baby placed flat on its back, the practitioner grasps the baby's thighs using his or her thumbs and index fingers. When assessing for Ortolani sign, the baby's thighs are abducted. When performing the Barlow test, the baby's thighs are adducted. With the baby's hips and knees at 90-degree angles, the hips are abducted. With developmental dysplasia of the hip, the trochanter dislocates from the acetabulum. The nurse would feel the dislocation while palpating the trochanter. Legs are extended to assess for equal leg lengths and for equal thigh and gluteal folds. When performing both the Ortolani and Barlow tests, the baby is placed flat on his or her back. When assessing for symmetry of leg lengths and tissue folds, the baby is placed in both the supine and prone positions. The order of the steps of the Ortolani procedure is 1. The nurse places the baby on the baby's back. 2. The nurse grasps the baby's thighs with a thumb on the inner aspect and forefingers over the trochanter. 3. With the knees flexed at 90-degree angles, the hips are abducted. And 4. The nurse palpates the trochanter to assess for hip laxity. The Barlow test is performed by 1. Adducting the baby's legs, 2. Gently pushing the legs posteriorly, and 3. Feeling to note any slippage of the trochanter out of the acetabulum. Galeazzi sign, to assess for uneven knee heights, can also be performed. The nurse in a medical unit is administering 9 o'clock medications. Which medication should the nurse question administering? 1. Acetylcysteine to a client who is coughing forcefully. 2. Cefazolin IV piggyback to a client diagnosed with the flu. 3. Diphenhydramine to a client who is congested. 4. Dextromethorphan to a client who has pneumonia. The correct answer is 1. Acetylcysteine to a client who is coughing forcefully. Acetylcysteine is a mucolytic. An adverse effect of mucomist is bronchospasm. This client should be assessed for bronchospasm before administering a dose of mucomist. Cefazolin is an antibiotic. Antibiotics are frequently administered to clients with viral infections to prevent secondary bacterial infections. This client is considered at risk, or the client would not be in a hospital receiving care. There is no reason to question this medication. Diphenhydramine is an antihistamine. Antihistamines are prescribed for congestion, so there is no reason to question this medication. Dextromethorphan is an antitussive. A symptom of pneumonia is a cough, so there is no reason to question this medication.
A client is taking clonidine for treatment of hypertension. The nurse should teach the client about which of the following common adverse effects of this drug. Select all that apply. 1. Dry mouth. 2. Hyperkalemia. 3. Impotence. 4. Pancreatitis. 5. Sleep disturbance. The correct answers are 1, 3, and 5. Clonidine is a central-acting adrenergic antagonist. It reduces sympathetic outflow from the central nervous system. Dry mouth, impotence, and sleep disturbances are possible adverse effects. Hyperkalemia and pancreatitis are not anticipated with use of this drug.
The pediatrician has ordered vitamin K 0.5 mg IM for a newborn. The medication is available as 2 mg per milliliters. How many milliliters should the nurse administer to the baby? Calculate to the nearest hundredth. To solve this problem, you set up the formula as 2 mg over 1 milliliters equals to 0.5 mg over x. You cross-multiply 2 times x and 0.5 times 1. You get 2x equals to 0.5. You divide 2 on both sides, and you get x equals to 0.25 milliliters. This is the amount that the nurse should administer for each dose. The client diagnosed with the flu is prescribed the cough medication hydrocodone. Which information should the nurse teach the client regarding this medication? 1. Teach the client to monitor the bowel movements for constipation. 2. Tell the client that it is fine to drive or operate machinery while taking this medication. 3. Instruct the client to plan for rest periods, as this medication usually causes insomnia. 4. Explain that this medication is more effective when taken with a mucolytic. The correct answer is 1. Teach the client to monitor the bowel movements for constipation. Hydrocodone is an opioid and can slow the peristalsis of the bowel, resulting in constipation. The client should be aware of this and increase the fluid intake and use bulk laxatives and stool softeners if needed. Opioids can cause drowsiness, so driving or operating machinery should be discouraged. Opioids usually cause the client to be drowsy and not have insomnia. Hydrocodone is a cough suppressant and a mucolytic is an expectorant. These are opposite-acting medications.
Metoprolol is added to the pharmacologic therapy of a diabetic female diagnosed with stage 2 hypertension, initially treated with furosemide and ramipril. An expected therapeutic effect is 1. Decrease in heart rate. 2. Lessening of fatigue. 3. Improvement in blood sugar levels. 4. Increase in urine output. The correct answer is 1. The effect of a beta blocker is a decrease in heart rate, contractility, and afterload, which leads to a decrease in blood pressure. The client at first may have an increase in fatigue when starting the beta blocker. The mechanism of action does not improve blood sugar or urine output.
4 newborns are in the neonatal nursery, none of whom is crying or in distress. Which of the babies should the nurse report to the neonatologist? 1. 16-hour-old baby who has yet to pass meconium. 2. 16-hour-old baby whose blood glucose is 50 milligrams per deciliter. 3. 2-day-old baby who is breathing irregularly at 70 breaths per minute. 4. 2-day-old baby who is excreting a milky discharge from both nipples. The correct answer is 3. 2-day-old baby who is breathing irregularly at 70 breaths per minute. Normal neonatal breathing is 30 to 60 breaths per minute. This baby is tachypneic. Meconium should pass within 24 hours of delivery. This baby's glucose level is within normal limits. A milky discharge, which is milk, is normal. It results from the drop in maternal hormones in the neonatal system following delivery. Which statement is the scientific theory for prescribing zinc preparations for a client with a cold? 1. Zinc binds with the viral particle and reduces the symptoms of a cold. 2. Zinc decreases the immune system's response to a virus. 3. Zinc activates viral receptors in the body's immune system. 4. Zinc blocks the virus from binding to the epithelial cells of the nose. The correct answer is 4. Zinc blocks the virus from binding to the epithelial cells of the nose. Theoretically, zinc blocks viral binding to nasal epithelium. Observation has shown that increased amounts of zinc can prevent the binding and prevent the development of symptoms of the rhinovirus. Zinc does not bind the viral particle. Symptoms are diminished by blocking the ability of the virus to bind with the nasal lining. Zinc is a micronutrient found in the body that helps to increase the body's immune system. Activating viral receptors would increase the symptoms of a cold.
When a client is diagnosed with aplastic anemia, the nurse should assess the client for changes in which of the following physiologic functions. 1. Bleeding tendencies. 2. Intake and output. 3. Peripheral sensation. 4. Bowel function. The correct answer is 1. Aplastic anemia decreases the bone marrow production of red blood cells, white blood cells, and platelets. The client is at risk for bruising and bleeding tendencies. A change in the client's intake and output is important, but assessment for the potential for bleeding takes priority. Change in the peripheral nervous system is a priority problem specific to clients with vitamin B12 deficiency. Change in bowel function is not associated with aplastic anemia.
A 2-day-old breastfeeding baby born via normal spontaneous vaginal delivery has just been weighed in the newborn nursery. The nurse determines that the baby has lost 3.5% of the birth weight. Which of the following nursing actions is appropriate? 1. Do nothing because this is a normal weight loss. 2. Notify the neonatologist of the significant weight loss. 3. Advise the mother to bottle feed the baby at the next feed. 4. Assess the baby for hypoglycemia with a glucose monitor. The correct answer is 1. Do nothing because this is a normal weight loss. The baby has lost less than 4% of its birth weight. Babies often lose between 5% and 10% of their birth weight. A loss greater than 10% is considered pathological. Supplementation is not needed at this time. There is no indication in the STEM that the baby is at high risk for hypoglycemia. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The client who has been using oxymetazoline nasal spray for several weeks reports to the nurse that the spray no longer seems to work to clear the nasal passages. Which information should the nurse teach? 1. Increase the amount of sprays used until the desired effect has been reached. 2. This type of medication can cause rebound congestion if used too long. 3. Alternate the oxymetazoline with a saline nasal spray every 2 hours. 4. Place the oxymetazoline nasal spray in a vaporizer at night for the best results. The correct answer is 2. This type of medication can cause rebound congestion if used too long. Oxymetazoline is a nasal decongestant. Oxymetazoline is recommended for short-term relief of nasal congestion for clients older than the age of 6. This medication is for short-term use only. Longer use can cause a rebound congestion that can be difficult to resolve. Oxymetazoline should be used every 10 to 12 hours only. Using it more often increases the chance of developing a dependence on the medication and rebound congestion. Oxymetazoline nasal spray is to be used intranasally. It is not an additive for a vaporizer.
The nurse is teaching a client with polycythemia vera about potential complications from this disease. Which manifestation should the nurse include in the client's teaching plan? Select all that apply. 1. Hearing loss. 2. Visual disturbance. 3. Headache. 4. Orthopnea. 5. Gout. 6. Weight loss. The correct answers are 2, 3, 4, and 5. Polycythemia vera, a condition in which too many red blood cells are produced in the blood serum, can lead to an increase in the hematocrit and hypervolemia, hyperviscosity, and hypertension. Subsequently, the client can experience dizziness, tinnitus, visual disturbances, headaches, or feeling of fullness in the head. The client may also experience cardiovascular symptoms, such as heart failure, and increased clotting time or symptoms of an increased uric acid level, such as painful, swollen joints. Hearing loss and weight loss are not manifestations associated with polycythemia vera.
A mother, 1 day postpartum from a 3-hour labor and a spontaneous vaginal delivery, questions the nurse because her baby's face is purple. Upon examination, the nurse notes petechiae over the scalp, forehead, and cheeks of the baby. The nurse's response should be based on which of the following? 1. Petechiae are indicative of severe bacterial infections. 2. Rapid deliveries can injure the neonatal presenting part. 3. Petechiae are characteristic of the normal newborn rash. 4. The injuries are a sign that the child has been abused. The correct answer is 2. Rapid deliveries can injure the neonatal presenting part. When neonates speed through the birth canal during rapid deliveries, the presenting parts become bruised. The bruising often takes the form of petechial hemorrhages. Petechiae can be present as a result of an infectious disease, for example, meningococemia. In this situation, however, there is no indication that an infection is present. Erythema toxicum, the newborn rash, is characterized by papules or pustules on an erythematous base. There is nothing in the scenario to suggest that child abuse has occurred. Although this question is about the neonate, the key to answering the question is knowledge of the normal length of a vaginal labor and delivery. Multiparous labors average about 8 to 10 hours, and primiparous labors can last more than 20 hours. The 3-hour labor noted in the stem of the question is significantly shorter than the average labor. The neonate, therefore, has progressed rapidly through the birth canal and, as a result, is bruised. Which OTC herb should be usually recommended for a client with a cold who has mild hypertension? 1. Hawthorn. 2. Ginger. 3. Garlic. 4. Golden seal. The correct answer is 3. Garlic. Garlic is used for colds and the flu and can also be given for hypertension. It causes mild vasodilation and will not make hypertension worse. Hawthorn is used for mild hypertension, congestive heart failure, and angina, but it does nothing for a cold or the flu. Golden seal is used for respiratory, digestive, and urinary infections, but it increases the effectiveness of some antihypertensive medications, beta blockers, and antidysrhythmics. It should be used with caution in clients who have cardiovascular disease, diabetes mellitus, or glaucoma.
Which of the following is a late symptom of polycythemia vera? 1. Headache. 2. Dizziness. 3. Pruritus. 4. Shortness of breath. The correct answer is 3. Pruritus is a late symptom that results from abnormal histamine metabolism. Headache and dizziness are early symptoms from engorged veins. Shortness of breath is an early symptom from congested mucous membranes and ineffective gas exchange.
A client with peptic ulcer disease reports being nauseated most of the day and now feeling lightheaded and dizzy. Based upon these findings, which nursing actions would be most appropriate for the nurse to take? Select all that apply. 1. Administering an antacid hourly until nausea subsides. 2. Monitoring the client's vital signs. 3. Notifying the physician of the client's symptoms. 4. Initiating oxygen therapy. 5. Reassessing the client in an hour. The correct answers are 2. Monitoring the client's vital signs, and 3. Notifying the physician of the client's symptoms. The symptoms of nausea and dizziness in a client with peptic ulcer disease may be indicative of hemorrhage and should not be ignored. The appropriate nursing actions at this time are for the nurse to monitor the client's vital signs and notify the physician of the client's symptoms. To administer an antacid hourly or to wait 1 hour to reassess the client would be inappropriate. Prompt intervention is essential in a client who is potentially experiencing a gastrointestinal hemorrhage. The nurse would notify the physician of assessment findings and then initiate oxygen therapy if prescribed by the physician. A mother asks the nurse to tell her about the responsiveness of neonates at birth. Which of the following answers is appropriate? Select all that apply. 1. Babies have a poorly developed sense of smell until they are 2 months old. 2. Babies respond to all forms of taste well, but they prefer to eat sweet things like breast milk. 3. Babies are especially sensitive to being touched and cuddled. 4. Babies are nearsighted with blurry vision until they are about 3 months of age. 5. Babies respond to many sounds, especially to the high-pitched tone of the female voice. The correct answers are 2. Babies respond to all forms of taste well, but they prefer to eat sweet things like breast milk. 3. Babies are especially sensitive to being touched and cuddled. And 5. Babies respond to many sounds, especially to the high-pitched tone of the female voice. Babies respond to all forms of taste. They prefer sweet things. Babies' sense of touch is considered to be the most well-developed sense. Babies hear quite well once the amniotic fluid is absorbed from the ear canal. All newborns' hearing is tested prior to discharge from the newborn nursery. If a baby is found to be hearing impaired, the baby should receive early intervention. All of the baby's senses are well developed at birth. Babies see quite well at 8 to 12 inches. They prefer to look at the human face. The client with the flu has been taking acetylcysteine. Which adverse effect should the nurse assess for? 1. Bronchospasm. 2. Nausea. 3. Fever. 4. Drowsiness. The correct answer is 1. Bronchospasm. Acetylcysteine is a mucolytic. Mucomist can cause bronchospasm, which will impair the client's breathing, not improve it. An adverse reaction is a reason to immediately discontinue the medication. Nausea is a side effect of many medications and can usually be managed by taking the medication with food. A side effect is not an adverse effect. Fever would result from the cold, flu, or infection, not from the medication. Drowsiness is caused by some cold and flu preparations, usually antihistamines. Mucomist causes the client to expectorate secretions, which will keep the client awake.
A client with macrocytic anemia has a burn on the foot and reports watching television while lying on a heating pad. Which action should be the nurse's first response? 1. Assess for potential abuse. 2. Check for diminished sensations. 3. Document the findings. 4. Clean and dress the area. The correct answer is 2. Macrocytic anemias can result from deficiencies in vitamin B12 or ascorbic acid. Only vitamin B12 deficiency causes diminished sensations of peripheral nerve endings. The nurse should assess for peripheral neuropathy and instruct the client in self-care activities for diminished sensation to heat and pain. The burn could be related to abuse, but this conclusion would require more supporting data. The findings should be documented, but the nurse will want to address the client's sensations first. The decision of how to treat the burn should be determined by the physician.
A client with a peptic ulcer reports epigastric pain that frequently causes the client to wake up during the night. The nurse should instruct the client to do which activities? Select all that apply. 1. Obtain adequate rest to reduce stimulation. 2. Eat small, frequent meals throughout the day. 3. Take all medications on time as prescribed. 4. Sit up for 1 hour when awakened at night. 5. Stay away from crowded areas. The correct answers are 1. Obtain adequate rest to reduce stimulation. 2. Eat small, frequent meals throughout the day. 3. Take all medications on time as prescribed. And 4. Sit up for 1 hour when awakened at night. The nurse should encourage the client to reduce stimulation that may enhance gastric secretion. The nurse can also advise the client to utilize health practices that will prevent recurrences of ulcer pain, such as avoiding fatigue and elimination of smoking. Eating small, frequent meals helps to prevent gastric distension if not actively bleeding and decreases distension and release of gastrin. Medications should be administered promptly to maintain optimum levels. After awakening during the night, the client should eat a small snack and return to bed, keeping the head of the bed elevated for an hour after eating. It is not necessary to stay away from crowded areas. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. To reduce the risk of hypoglycemia in a full-term newborn weighing 2,900 grams, what should the nurse do? 1. Maintain the infant's temperature above 97.7 degrees Fahrenheit / 36.5 degrees Celsius. 2. Feed the infant glucose water every 3 hours until breastfeeding well. 3. Assess blood glucose levels every 3 hours for the first 12 hours. 4. Encourage the mother to breastfeed every 4 hours. The correct answer is 1. Maintain the infant's temperature above 97.7 degrees Fahrenheit / 36.5 degrees Celsius. Hypothermia in the neonate is defined as a temperature below 97.7 degrees Fahrenheit. Cold stress syndrome may develop if the baby's temperature is below that level. A healthy neonate does not need supplemental feedings, and if supplements are needed, they should be either formula or breast milk. There is no indication in the STEM that glucose assessments are needed for this baby. Babies should be breastfed every 2 to 3 hours. Feedings every 4 hours are not frequent enough. It is important for the student to know that a baby weighing 2,900 grams is an average-sized baby. They range 2,500 to 4,000 grams. In addition, because no other information is included in the STEM, you must assume that the baby is healthy. The answers, therefore, should be evaluated in terms of the healthy newborn. Hypoglycemia can result when a baby develops cold stress syndrome because babies must metabolize food to create heat. When they use up their food stores, they become hypoglycemic. The mother of a teenage girl asks the nurse why her daughter would have many boxes of pseudoephedrine in her room. Which statement is the nurse's best response? 1. Has your child always had allergy problems? 2. Teenagers will try to take care of their own health problems. 3. Has your daughter's behavior at school or at home changed recently? 4. Remove the medication and say nothing to your daughter about it. The correct answer is 3. Has your daughter's behavior at school or at home changed recently? Pseudoephedrine is an antihistamine and is used in the manufacture of methamphetamines. This situation could indicate the teenager is involved with the drug culture, taking or manufacturing drugs. The nurse should assess for signs of drug involvement.
A client with microcytic anemia is having trouble selecting food from the hospital menu. Which food is best for the nurse to suggest for satisfying the client's nutritional needs? 1. Egg yolks. 2. Brown rice. 3. Vegetables. 4. Tea. The correct answer is 2. Brown rice is a source of iron from plant sources. Other sources of non-heme iron are whole grain cereals and breads, dark green vegetables, legumes, nuts, dried fruits, oatmeal, and sweet potatoes. Egg yolks have iron, but it is not as well absorbed as iron from other sources. Vegetables are a good source of vitamins that may facilitate iron absorption. Tea contains tannin, which combines with non-heme iron, preventing its absorption.
A client with peptic ulcer disease is taking a histamine 2 receptor antagonists. What is the expected outcome of this drug? 1. Heal the ulcer. 2. Protect the ulcer surface from acids. 3. Reduce acid concentration. 4. Limit gastric acid secretion. The correct answer is 4. Limit gastric acid secretion. Histamine 2 receptor antagonists reduce gastric acid secretion. Antisecretory or proton pump inhibitors, such as omeprazole, help ulcers heal quickly in 4 to 8 weeks. Cytoprotective drugs, such as sucralfate, protect the ulcer surface against acid, bile, and pepsin. Antacids reduce acid concentration and help reduce symptoms.
A 68-year-old client on day 2 after hip surgery has no cardiac history, but reports having chest heaviness. The first nursing action should be to 1. Inquire about the onset, duration, severity, and precipitating factors of the heaviness. 2. Administer oxygen via nasal cannula. 3. Offer pain medication for the chest heaviness. 4. Inform the physician of the chest heaviness. The correct answer is 1. Inquire about the onset, duration, severity, and precipitating factors of the heaviness. Rationale. Further assessment is needed in this situation. It is premature to initiate other actions until further data have been gathered. Inquiring about the onset, duration, location, severity, and precipitating factors of the chest heaviness will provide pertinent information to convey to the physician.
Which factor is unique to malpractice when comparing negligence and malpractice? 1. The action did not meet standards of care. 2. Inappropriate care is an act of commission. 3. There is harm to the client as a result of the care. 4. There is a contractual relationship between the nurse and client. The correct answer is 4. There is a contractual relationship between the nurse and client. Only malpractice is misconduct performed in professional practice, where there is a contractual relationship between the client and nurse that results in harm to the client. There is a violation of standards of care with both negligence and malpractice. Negligence and malpractice both involve acts of either commission or omission. The client must have sustained injury, damage, or harm with both negligence and malpractice.
The nurse is providing care for a patient with a connective tissue disorder exacerbation for whom the healthcare provider has prescribed an IV dose of methylprednisolone 20 milligrams in 50 milliliters normal saline to be infused over 30 minutes. At what rate will the nurse set the IV infusion pump to administer this drug correctly? The correct answer is 100 milliliters per hour. Rationale. The formula is volume in ml multiplied by 60 divided by time in minutes. You multiply 50 times 60 and divide by 30 minutes. The end result is 100.
The nurse instructs the client who has had a hemorrhoidectomy not to use sitz baths until at least 12 hours post-operatively to avoid inducing which of the following complications? 1. Hemorrhage. 2. Rectal spasm. 3. Urine retention. 4. Constipation. The correct answer is 1. Hemorrhage. Applying heat during the immediate post-operative period may cause hemorrhage at the surgical site. Moist heat may relieve rectal spasms after bowel movements. Urine retention caused by reflex spasm may also be relieved by moist heat. Increasing fiber and fluid in the diet can help prevent constipation. A 22-year-old patient with stage 1 Hodgkin disease is admitted to the oncology unit for radiation therapy. During the initial assessment, the patient tells the nurse, "Sometimes I'm afraid of dying." Which response is most appropriate at this time? 1. Many individuals with this diagnosis have some fears. 2. Perhaps you should ask the doctor about medication. 3. Tell me a little bit more about your fear of dying. 4. Most people with stage 1 Hodgkin disease survive. The correct answer is 3. Tell me a little bit more about your fear of dying. More assessment about what the patient means is needed before any interventions can be planned or implemented. All of the other statements indicate an assumption that the patient is afraid of dying of Hodgkin disease, which may not be the case. The nursery nurse is careful to wear gloves when admitting neonates into the nursery. Which of the following is the scientific rationale for this action? 1. Meconium is filled with enteric bacteria. 2. Amniotic fluid may contain harmful viruses. 3. The high alkalinity of fetal urine is caustic to the skin. 4. The baby is at high risk for infection and must be protected. The correct answer is 2. Amniotic fluid may contain harmful viruses. Amniotic fluid is a reservoir for viral diseases like HIV and hepatitis B. If the woman is infected with those viruses, the amniotic fluid will be infectious. Meconium is a sterile stool. The newborn will not produce gastrointestinal bacteria until a few days after delivery. Fetal urine is not highly alkaline. Although babies are at high risk for infection, there is no need for nurses to wear gloves routinely when caring for the babies. Immediately after delivery, the nurse is protecting himself or herself from the baby, not the other way around. By wearing gloves, the nurse is practicing standard precautions per the Centers for Disease Control and Prevention to protect himself or herself from viruses that may be present in the amniotic fluid and on the neonate's body. This question illustrates how important it is for you to read each possible answer very carefully. For example, you may be tempted to choose choice 1, but the fact that the option states that meconium contains enteric bacteria makes that answer incorrect. You can get the NCLEX Mastery Bundle now, link is in the description, or you can get it at alphanurseguide.com.